Hello friends, in this video we are going to see the important questions of OBG, and this is a continuation of the last video. The last video we have seen the questions from the first unit. So in this video we are going to see the important questions that was has from the previous year question papers, and the questions are from the second unit. So the first question is explain the physiology of normal menstrual cycle. So now we'll see what's the physiology of normal menstrual cycle. So before going into the menstrual cycle, we should understand the meaning of menstruation. So menstruation is a periodic discharge of blood and cellular debris from the female genital tract, and these cyclical changes occurs during every month, and the duration of the normal menstrual cycle is about 28 plus or minus 4 days. So in the normal physiology of menstruation, you need to write the phases of menstruation. So it is divided into three phases. One is the proliferative phase, secretory phase, and the menstrual phase. Now we'll see one by one. So the menstrual phase usually lasts for 3 to 5 days, and if the ovum is not fertilized, the corpus luteum regresses itself from the 24th day of the cycle, and this usually occurs because of the decrease in the estrogen levels and also the levels of the progesterone. So usually what happens when these levels are reduced, the corpus luteum undergoes a degenerative changes from the 24th day of the cycle, and because of this changes that occurs in the corpus luteum, they cause the shrinkage of the endometrium and resulting in the necrosis of the surrounding endometrium, and this causes the endometrium to get shed along with the blood and other secretions. So this is what happens in the menstrual phase. Next is the proliferative phase. In the proliferative phase, what happens is usually this starts at the end of the menstrual phase, and its duration is about 10 days. At the beginning of this phase, the endometrium has been desquamated. You already know that was desquamated in the earlier stage. Now it starts to get healed, and then it itself proliferates rapidly from the 5th to 14th day of the menstrual cycle. So whatever the changes that has occurred in the endometrium and the shedding of the endometrium has occurred in the previous menstrual phase, now we see in this proliferative phase the endometrium starts healing itself, and then it rapidly proliferates from 5th to the 14th day of the menstrual cycle. Again, what happens in the proliferative phase is under the influence of estrogen, there is a growth of simple tubular glands, the blood vessels in the endometrium, and the endometrium increases in thickness from about 3 to 5 millimeter, and also there is a changes in the endometrial glands which makes it to produce a thick mucus. And the end of the proliferative phase, what happens is ovulation starts. Okay, the end of the proliferative phase, the ovulation starts. The next is the secretory phase. So it is a luteal phase, and in this phase it lasts for usually for about 14 days, and it is the beginning when the ovulation has already occurred, and it is the beginning of the glands to become bigger, and also it is filled with the secretions, and also here the stromal cell starts to proliferate and becomes more coiled and dilated. This is mainly because of the action of the progesterone and estrogen on the uterine endometrium. Next, there is an accelerated growth of follicles, and more amount of estrogen is secreted into the follicles. Into the follicles, and this stimulates granulosa cells to form increased amount of FSH receptors, and this makes the granulosa cells more sensitive for FSH, that is follicle stimulating hormone. So this FSH and estrogen promotes the LH receptors and the granulosa cells, resulting in the increase of the follicular secretions. And also this estrogen and LH will cause the further proliferation of these thicker cells and causes them to increase their secretions. Again, in the important event of the menstruation is the LH surge and ovulation. How exactly the LH surge and the ovulation occurs? The LH surge occurs, there is a release of the follicular steroid hormone which releases the proteolytic enzyme and the prostaglandin, which in turn acts on the degeneration of the follicles and the swelling of the follicles, resulting in the rupture of the follicles and making the ovum to get expelled out. So these are the things that you are supposed to write when they're asking for the physiology of normal menstrual cycle. The next question what we are going to see is about the fetal development. So when they were asking the fetal development, you are supposed to write them in the stages. What happens? First of all, you need to write about the pre-embryonic period, that is the first 2 weeks after the conception, and the embryonic period is the beginning at the 15th day through the 8th week after conception, and the fetal period is the beginning of the 9th week and ending of the birth. We call it as a fetal period. So you have to write this stages of fetal development. First is pre-embryonic period, embryonic period, and the fetal period. Now rapidly we will discuss about the stages in the week wise. So in the week 1 there is a blastocyst that is found as floating very freely, and next after the second and the third week you're going to see that the embryo increases in the length from 1.5 to 2 millimeter, and the lung bud starts to appear. There is also the blood circulation begins, and the heart is tubular and begins to beat, and also the neural plate becomes the brain and the spinal cord. So very most important changes that occurs in the second to third week. Next, in week 5, you can see the embryo is almost at the length of 0.4 to 0.5 centimeters, and also you can see the embryo is about 4.4 grams, and the double heart chambers are visible now, and the heart starts to beat, and the limb birds form. Week 8, that is embryo is 3 centimeter in length, embryo is 2 grams, and eyelids begins to fuse, and circulatory systems through the umbilical cord is well established, and every organ system is almost present during the 8th week. Week 12, fetus 6 to 9 centimeter in length, fetus is 19 gram, face is well formed, limbs are long and slender, kidneys begin to form urine, spontaneous movement occur, heartbeat is detected by the Doppler transducer between the 10th week, and almost the sex is visibly recognizable now. At 16th week, you can see the fetus is almost 11.5 to 13.5 centimeter. Fetus is under gram. Active movements are present. Fetus skin is transparent. Lanugo begins to develop, and also there is a skeletal ossification. And week 20 is fetus is almost 16 to 18.5 centimeter in length. Fetus 300 gram. Lanugo covers the entire body, means it's a downy and shiny hair which is covering the fetus. And fetus has nails and muscles are developed. Enamel and dentin are depositing, and heartbeat is detected by a regular non-electronic fetoscope. At week 24, you can see the fetus is almost 23 centimeters in length. Fetus is 600 grams. Hair on the head is well formed, and the skin is reddish and wrinkled. Reflexes like grasping reflex is present in the hand, and vernix caseosa covers the entire body, and the fetus has the ability to hear. At 28 week, you can see the fetus is almost 27 centimeter in length. Fetus is 1100 grams, and limbs are well flexed. Brain is still developing rapidly, and eyelids open and close. Lungs are developed sufficiently to produce gas exchange, and if at all if they are born at this 28th week, the neonates can breathe. At 32 weeks, the fetus is 31 centimeter. It weighs about 1800 to 2100 grams, and bones are fully developed. Subcutaneous fat has been collected, and you can see the lecithin to sphingomyelin ratio is almost to 1:2:1, means it is a surfactant that is usually produced over the lungs. At 36 week, fetus is 35 centimeters in length, and fetus is 2200 to 2900 grams. The skin is pink and body is rounded. Skin is less wrinkled and lanugo is disappearing, and LS ratio, that is less than sphingomyelin ratio, is almost 2:1. And week 40 you can see fetus 40 centimeter length, fetus more than 3200 grams, skin is almost pink and smooth, lanugo is present on the upper arms and shoulders, vernix caseosa means it is giving the protection for the baby's skin, and the fingernails extend beyond the fingertips. You can also see the plantar creases run down to the heel, and testes are in the scrotum for male babies, and labia majora is well developed in the female babies at the 40th week. So this is about the fetal development in stages. What all happens in the week wise, then you should write for this if you are asking it for 5 marks or 10 marks. The next question is about explain abnormalities of placenta, and this one you can see in my shorts video. The next question is enumerate the functions of placenta. I'll give you a quick answers for this fourth question. Now we'll see the functions of the placenta. The first one is the respiratory function. So usually the respiration in the placenta takes place in the form of a simple diffusion and also with the help of partial pressure gradient. And usually the oxygen supply is usually at the rate of 8 ml per kg per minute. So the next one is the nutritive function, and the placenta almost helps in the diffusion of the glucose and also helps in the direct transports of lipids, and amino acids also gets transported to an active transport. You can see the exchange of water and electrolytes and other simple diffusion through which electrolytes like sodium, potassium and chloride is getting passed. You can also see there is an active transport of certain minerals, and also you can see the water soluble vitamins gets actively transported across, and also certain fat soluble vitamins get transferred slowly with the help of placenta from the mother to the fetus. You can see that these are the nutritive functions which is very much important in placenta. Next is enzymatic function, through which you can see there is a so in the enzymatic function you can see with the help of oxidation and other reduction process and the enzymatic functions, the placenta tries to protect the fetus from the unwanted substances which endangers the fetus, and that is with the help of oxidation it tries to reduce or inactivates the pressures passing through the placenta, and it also inactivates the oxytocin, which can again cause the premature delivery if it is passing through the placenta, and also certain phospholipase production also has been controlled by the placenta. So these are the enzymatic functions that is taking place in the placenta, and it also is responsible for its excretory functions like urea, uric acid and creatinine. With the help of a simple diffusion it's also responsible for anabolic expiratory functions. So in the enzymatic function itself, I told you placenta reduces the pass of certain chemicals which endangers the fetus. So here placenta also gives some of the barrier protection for the fetus, and so the placenta is also having the barrier function. So it acts a barrier for the noxious substances. A placenta has also got immunological function. That means certain hormones produced by the mother can itself act against the fetus. So always the placenta tries to prevent these type of hormones crossing across the placenta and damaging the fetus. So usually it gives protection against almost all the hormones that is produced by the mother, because in the mother's body always treats the fetus as a foreign body, right? So what happens here, sometimes the mother's hormone itself can damage the fetus. So placenta always tries to protect the fetus by providing the immunological functions against the maternal hormones and other infectious agents. So it also has a certain endocrine functions like It is responsible for producing hormones like protein hormones, human chorionic gonadotrophin hormone, human placenta lactogen, pregnancy specific beta 1 glycoprotein and growth factors, and also pregnancy associated plasma protein A. So these are the hormones which are usually produced by the placenta, which helps in the development of the baby. So the other functions of placenta includes the temperature maintenance. So if you want to remember the functions of placenta, you can write it in this way, like you can remember in this mnemonics, that is yes, storage, endocrine function, respiratory function, protection, excretion, nutrition and transfer. So you can write it in the mnemonics of like serpent. That means storage, endocrine, respiratory function, protection, excretion, nutrition and transfer. So these are the main functions of placenta, usually asked for 5 marks question. So thank you friends. So you have seen the 3 important questions from the previous year question papers, that is from the unit 2. It was about the menstrual cycle physiology. We also have seen fetal development and functions of the placenta. The next video will continue the remaining questions. Thank you. If you do like this video, do share, comment and subscribe my channel. Thank you.